The COVID crisis has put a spotlight on some of the challenges nursing homes face, even during the best of times. Today, we're going to share one family's struggle as an example of how hard it can be to care for an elderly family member in the middle of a pandemic. Paula Topman joins us live now. And Paula, this family's case is really tough to hear.
Karen, it really is. The daughter of this 97-year-old contacted me because she wanted to sound an alarm for others. Based on what happened to her mother, not once, but twice in less than 3 months, I do want to warn you, some of the images could be unnerving. When Carol Stutrud looks at her mother today, she wonders what happened because 90 days ago, her mother Irene was a relatively active 97-year-old.
Oh, that is...
When she had a minor fall at her assisted living facility in Warren, a decision was made to move her to rehab for skilled nursing. That was just before the state shut down because of COVID. And what happened has been a series of what Carol calls horror stories.
Like an endless hamster wheel that you never get off.
Like many families, Carol was cut off from her mother other than window visits. So she couldn't assess her health, couldn't see that she was losing weight, not getting meds. Her belief is that her mother became a side effect of overworked, underscheduled, waning staff because of COVID.
You do some of these window visits and your loved ones may be clothed or heavy sweaters on or something else where you think, oh, they look pretty good, until you get up close and personal. And unfortunately, one of the window visits when Mom was in the skilled nursing facility, she suffered a seizure right in front of my eyes and my sister's eyes on the other side of the window. And the staff felt that they were not qualified to realize it was a seizure. And they indicated that was her snoring. And she snores with her mouth open, her neck back, and her eyes wide open. And she was crying.
And this didn't just happen at one nursing home, but when Carol got her mother moved to a second care center, the same thing happened. Now her mother is at her home. 90 days ago, her mother was 100 pounds. Today, she is barely 75. Wendy Jones is the founder of Next Step for Seniors. Her sole job is to help families place seniors in care centers. And yet today,
if you have an opportunity to keep your loved one with you, whether you use home care, other family members, I mean, I would love to see people do that.
Melissa Samuels is the president and CEO of Healthcare Association of Michigan, the industry association for care centers and nursing homes. She believes that while the nursing home and skilled care industry has been hit hard by COVID, it is not fair or reasonable to paint all care centers with the same broad brush.
It's unfortunate that I think we already have finger pointing and scapegoating going on, and we're not even through this virus. We're not even nearly through the virus. I think we have a long way to go. I think we need to rally around and lift up our providers and their staff.
Yeah, so 3 different perspectives here, but they all have uniform agreement on pretty much one thing, and that is it is very difficult to place elders to begin with, and now is not a time to do it alone. Enlist the help of professionals. They know the lay of the land. They know what's going on the ground level in real time for in-care help as well as skilled nursing help. Find a professional to help you get your loved one placed if you're not able to keep them at home. Karen?
Some good advice, and obviously make sure to do some of the research ahead of time in terms of complaints and violations of those centers. Thank you, Paula. A federal